class.
So anyways, here, observation. What's the first thing you're supposed to figure out with observation? Gait. Remember that? So gait. That's the first thing. So gait. Okay, so what are we going to do with gait? Someone raise their hand and tell me how they're going to assess their patient with gait. What are they actually going to do? Hang on. Nice and loud.
We'll have them take off their pants if they're wearing any, and we'll ask them to walk a certain distance to see if they're any compensating in their walk, if they're limping, anything like that.
How's that sound? You guys hear them? Maybe not, but I mean, you're going to take their trousers off, leave their shorts on. I don't know what you've been told. I would say take their shoes and socks off as well. Hopefully your floors are clean, and let them walk. And what are you looking for?
Compensation.
Any abnormalities, compensations? Are you going to ask about pain?
Yes.
Symptoms? Yes. So perfect. That was excellent. So gait, and I'm going to go back to Trendelenburg gait because you need to know about that in a minute. But let's go ahead and talk about Trendelenburg gait. Have you guys heard this term before? Trendelenburg. What have you learned is the function of the hip abductors? You remember? Abduct the leg. Is that right? So you learn that gluteus medius, gluteus minimus, probably tensor fasciae lata, maybe some other ones that I'm missing. Their primary function in life is to do what? Abduct the leg. But what if my leg is standing flat on the ground? What's now the function of the hip abductors?
Stabilization.
Balance. But what specifically it's supposed to do to my pelvis? Do you guys know?
Keep it aligned.
Keep it aligned. So if my pelvis is weak, my hip abductors are weak on this side. Now some of you are starting to lose it at this point, but just follow me. If my pelvis, if I'm standing on one leg, I want to maintain my pelvis level. If my hip abductors are weak on this side, what's going to happen to my pelvis? It's going to drop this way. Do you understand why? Because now the origins and insertions have shifted a bit. So now if the muscle's weak and it can't hold my pelvis up this way, it's going to drop. What do we call that? A Trendelenburg. We call it the Trendelenburg sign. And what do you think a Trendelenburg gait would look like? Can anybody imitate the Trendelenburg gait?
Just like that. No.
So you guys, we're too easy on you guys. 2 classes ago, I think we made everybody assume a disability like on a Saturday. So you had to assume a disability. We gave you a funky gait, and you had to go to the commissary and go walk with this gait.
Oh, no way.
And then we had to have one of your classmates kind of film this and figure out how people are looking at you strange. What's the purpose of that? It gives you a little bit of insight as to how people with these gaits and different disabilities feel when people kind of look at them, because we're not used to seeing Trendelenburg gaits, are we?
It just is.
Can anybody figure out what a Trendelenburg gait would look like? Somebody want to demo it?
Like a 50s poster.
Let's see.
Gangster walk. And when he walks,
Now, that's interesting because he's bringing his hip up a little bit on this side, so he's hiking up on this side. That could be one way to compensate. Another way to compensate could be to, as I'm walking, if my stance faces this side, I have a weak gluteus medius on this side, is to lurch over this way, bring this leg up. Can you see that? As I come up, my hip abductors, once they're weak, I'm going to drop down. I don't want to drop down, so I could do what you did and maybe use my abdominals on this side, or if my abdominals are weak here, I'm going to have to come all the way off to the side, lurch off to the side. So your book talks about that as being uncompensated and compensated Trendelenburg. Let's watch this video here, and let's see what happens. Then you're all going to have to demonstrate Trendelenburg gaits because we only have one person that did it. So this is what it would look like here. So normal, when you put your patient in single leg stance, on the left, that hip should be level. The pelvis should be level. If the pelvis drops, right, if the pelvis drops on this side, what side is weak? That's right. Contralateral side is weak. All right? So let's listen to this video here and see what this person has to say. And then we'll show you a couple of really nice examples, outstanding examples, I think, maybe the best thing I give you guys are these examples of Trendelenburg gaits.
This next sign is called the Trendelenburg. Next sign is called the Trendelenburg sign, and this is something that you would observe in your patient who matches to a single leg stand. The Trendelenburg sign is when you ask your patient to stand on one leg, a normal patient would be able to have a strength in their hip abductors, abductors, to be able to keep their pelvis level. If they have weakened hip abductors, they're going to have a contralateral hip drop. So when they bring their leg up, instead of staying nice and stable, you're going to see this. And so it's a little bit of a kicking out of the weak side of contralateral lean. Sometimes patients will compensate by doing this, an ipsilateral lean, because now they're balanced over their stable foot. So positive Trendelenburg sign for weak hip abductors is here. You might see a patient walk in with a weak side, sorry, side to this side, a weak side, if they walk in, they drop as they walk. That's a positive Trendelenburg.
So can anybody demonstrate a Trendelenburg gait? I have a bad back today, and I can't do it without tearing myself up. I could do it, but I'm not going to. Someone demonstrate a Trendelenburg gait. We're going to show you some real live ones.
What is that?
What do you guys think?
No.
Well, then get up and show me.
That's close. That one's close. That one's close. Do that one again, though. Just go up and down this aisle a couple times. Try that one more time. Try one more time. I think you were really close. But go that way.
I was trying to drop my hip. Oh.
There it is.
Yeah.
So as she steps on that left leg, that right hip is dropping. Do you see that?
Or I could compensate and bring this. That would be this side.
Let's
Up
see.
and over. But it looks really awkward. You can put me on YouTube.
It looks normal.
That's pretty good. This is important, and you think we're having some fun with this, but this is kind of an important finding. And take a look at these patients here. These are real patients. And I think that
This next sign is called the Trendelenburg sign, and this is something that you would observe in your patient when you ask them to do a
let's see if we can get this one to come.
Take out the word gate. Take out word gate.
What's that?
Take out the word gate for this.
Watch these here.
This next sign is called the Trendelenburg sign, and this is something that you would observe in your patient when you ask them to do a single leg stand. The Trendelenburg sign, when you ask your patient to stand on one leg, a normal patient would be able to have the strength in their hip.
What the heck?
Sign is called the Trendelenburg.
Same person.